Hello, this is Dr. Taylor, and I'm sitting here in my study at home, and I just wanted to talk to you about a patient that I have seen, and I've seen more and more of this. These school-age children who are being so overwhelmed by school and other things in their life that it's causing real problems. This is an extremely smart 16-year-old who had to quit school or drop out of school for a while because she was so stressed, she couldn't think, she couldn't perform in school. She was really having anxiety problems and behavioral problems at home. And this patient was referred to me by a mental health consultant who had put her on an antidepressant. But as I talked with her, she seemed to say that this really got started right around puberty, which was 3 or 4 years ago, and just continued to get worse. And I want to show you the results of her saliva test because I want to show you what stress will do. And first, the stress hormone is cortisol, and cortisol should be high in the morning and low at night. But when you're under chronic stress, you can see that in this patient, you see these dots here. The patient collects their saliva 4 times during the day. This is the normal range, and hers is excessively high. And so that makes you feel like you're in the fight or flight state at all times. So you're super sensitive. She said that all of the stimuli coming at her would make her incredibly anxious. And that's what happens when you have high cortisol. And cortisol also disrupts other hormones. And at puberty is when you start to cycle estrogen and progesterone. And this is her estradiol. It should be here in this range, and you see it's way up here. And what happens is that you will make too much estrogen and you won't ovulate and you won't make progesterone. And you see her progesterone is down here. And then you see her testosterone is up here. Now this is a 16-year-old. She's not on any hormones, but what happens is that when you don't ovulate and don't make progesterone, then testosterone will increase to try and match the level of estrogen. So you have a male hormone trying to come in and balance out this female hormone. But high testosterone in women can make women very aggressive. And that is kind of how she was behaving, very aggressive toward her parents. And so this is just showing you what can happen when you're under stress. And I'm seeing more and more kids who are overwhelmed by all of the activities and the pressure in school. Now, how do you treat this? Well, 1, we gave her progesterone. 2, we used our product Serene Calm in order to lower cortisol levels. What Serene Calm will do, it has phosphatidylserine in it, and it will kind of instruct the brain that it should go back into the normal range. What it does is it makes the brain recognize that that level is too high, and it brings it back to normal. We also use our product Adrenacare. Adrenacare has adaptogens, and what that does, it helps your body to better adapt to stress, so that this stress curve here, this stress level here, will go back into a normal range. We also gave her our product Amino Restore because amino acids will allow her brain to make some of the calming neurotransmitters so she won't be so highly stimulated by all of the stimuli around. But I really just want to show you this case to show you how early stress can affect someone. And if you don't figure it out, what will happen is that this person will be on more and more medication. And that's just awful to start someone on these medications at such an early age of 16. And really, you're pretty much, if you don't understand this and do it correctly, you're pretty much have sentenced this girl to a lifelong journey down this medication pathway. So again, I'm seeing this more and more. I just want to go over this with you to let you understand a different way to look at